We're going to start with welcome and opening from Madame Shiluva Nkanyani, and then thereafter we'll proceed with the session. But before we go there, I'm your facilitator. My name is Suilanji Sinyangwe. Then I'm also with the Food, Agriculture, and Natural Resources Policy Analysis Network, FANAPAN. Over to you, Shiluva. Thank you.
Thank you, Subilanji. My name is Shiluva Nkanyani. I work with FANAPAN as well, and I'm sure a lot of people have been in communication with me regarding the applications and everything. But I just want to welcome everyone to day 2 of our virtual forum, and I just want to give you a brief of what actually happened yesterday for those who missed out. We actually had a lot of exciting innovations that were presented here. We had a presentation from different organizations, and yesterday's presentations were actually focusing on technology, innovation, partnership that can also help improve food systems in Africa. So the forum yesterday really brought together researchers, policymakers, farmers, development partners, youth, and innovators from different countries. And one of the most important messages that came out from the discussions yesterday was that Africa has a lot of potential. Our lands are fertile. We have young people, we've got researchers, and many innovative ideas. And however, regardless of having all those things, Africa is still faced with food insecurity, climate change, crop diseases, post-harvest losses, and also we still have limited to access to the market. So the speakers yesterday, they really explained quite a lot of things. We had presentations from the Agricultural Research Council in South Africa. We also had presenters from the International Potato Center, and we also had presentations from Master, I think, in University of in Zimbabwe. I forgot what the place where the university is based, but yesterday the discussions were really were about how we can utilize information that we have from researchers to feed into the policy work. And also we saw various I think the Agricultural Research Council, they were presenting on the aquaponics innovations that they were really that they are working on. And most of that has been loaded on YouTube for everyone to just see what actually happened yesterday. And I urge everyone today to listen in very carefully, and you can actually have potential to have collaborations. You can be exchanging email addresses. I think it's allowed that you can inbox someone here on the contacts list, if someone that is from an institution of interest, that you can easily exchange email addresses, and then we can have future collaborative innovations that are going to be generated from here. Apart from that, colleagues, I wish you a very successful day 2 of the virtual forum. Let's stay in contact. Thanks.
Thank you very much, Shiluva. I think that was a very good summary of the deliberation of yesterday, very rich indeed. And we'll definitely look forward to get those YouTube videos so that we can get the key insights. So going forward with the program, we'll start with the first session of the day, which is being led by Dr. Rose Omari, and specifically then the session is on food environment and nutrition outcomes. And then it's specific to the FETE project by the CSIR and STEPPRI and partners. So like Shiluva guided in the beginning, each session then is given 30 minutes inclusive of the 5 minutes question and answer. So then I'll proceed to give the floor to Dr. Rosie Omari and the team.
Thank you. And so I'm the moderator. My name is Albert Alote. I'm with the Council for Scientific and Industrial Research, Science and Technology Research Policy Institute in Accra. I am your moderator. We're going to start, and we have Daniela coming to give us an introductory remarks, and then to be followed by Nyabasi. Then Geoffrey will continue, and then Wendy will sum it all. Then we go to questions and answers. Then we go to Rose giving us the closing remarks. I will urge you all to sit up and listen carefully. Good morning, everyone. Bonjour, everyone. Thank you. So I'm going to share my screen whilst I hand over to, I will hand over quickly to Daniela. She will introduce herself and then she will start her presentation. So Daniela, over to you. Yes.
Thank you, Albert, so much for introducing the session and also me. So I also a warm welcome from my side to everyone who has joined us for this session on the food environments and nutrition outcomes. And over the next few minutes, I will give you a brief introduction about the StEPPFoS project and explain what it is about. So please, the next slide, Albert. So the StEPPFoS project in a nutshell. StEPPFoS stands for Shaping Food Environments in Transitioning Economies for Sustainable and Healthy Diets. The project is already running since 2023 and aims to examine how food environments influence individual diet quality and nutritional outcomes. The project is a collaborative initiative implemented by a consortium of partners across Africa and Asia and coordinated by the Thun Institute in Germany, where I belong to. So on the screen, you can see all the partners. It's the University of KwaZulu-Natal in South Africa, the University of Nottingham in Malaysia, and also the Council for Scientific and Industrial Research in Ghana and the Sokoine University of Agriculture in Tanzania. So the project ends at the end of this year. And before I go into more detail about the project, I like to briefly explain what we understand about food environments. So I come to that slide right now. Food environments are part of the food system, and they are defined as the consumer interface with the food system that cover different elements such as the availability of food and beverages, but also the affordability, the convenience, the desirability, and the sustainability. And many conceptual frameworks typically also distinguish between the external and the personal food domains of the food environment, as also illustrated in this graph. And further evidence supports that the food environment play a critical role in shaping dietary behaviors and health outcomes, and that especially unhealthy food environments. Albert, please back one slide. I'm not that far yet. So, yeah, right. Here I'm still on the food environment. So that what I wanted to say is that especially the unhealthy food environments, they really contribute to poor diet quality, to rising overweight and obesity, and to the double burden of malnutrition. And this is particularly happening among the urban poor. And here is where the project comes in. And I will give you now a brief explanation of the key elements of the StEPPFoS project. So please, next slide. Thank you. So the project focuses on Tanzania, Ghana, South Africa, and Malaysia, because in these countries, the food environments are reshaped due to urbanization, globalization, income growth, and changing consumer preferences. And the first contribution of the session will provide more details on the nutrition transition in these countries. Then another key element of the project is that we target on the deprived urban communities, as those are particularly affected by the changing food environments. And we study the external and personal food environments within the project, but also the policy frameworks of all the 4 countries by using different methods. And by applying a joint research agenda that in the end allows us for the inter-country analysis. And that is the point where the second and the third contribution of the session comes in. The second contribution gives us some results of the food environment study, and the third contribution of the policy analysis. Another important aspect of the project are the stakeholder engagement workshops in all those countries from the beginning on of the project, and they are part of the transdisciplinary approach, but not part of the session today. So with that brief introduction, I will give back to Albert. Thank you.
Thank you. Thank you. I'll plead with the presenters, you try as much as possible to move according to the time. Thank you very much for your introductory remarks. And the next one, we're calling Dr. Nyabasi, who is going to do the next presentation as we go on. Kindly introduce yourself. Yes, good.
Yes, thank you so much, Dr. Aloti. As I've been introduced, my name is Nyabasi Makori from Sokoine University of Agriculture, Tanzania. So I'm going to present the study that assessed trends on food supply in 4 countries: Tanzania, Ghana, South Africa, and Malaysia. It is a comparative analysis of 40 years. So food systems are undergoing rapid transformation driven by a combination of interrelated factors, including economic growth, urbanization, dietary shift, and trade integration. So the global population increased from 4.4 B up to 8 B in 2022, placing increasing demand on food security. And the demographic expansion has been accompanied by rapid urbanization, particularly in low and middle income countries, shifted dietary preferences. So understanding the long-term trends in food supply for the past 40 years is essential for assessing food system resilience and informing nutrition-sensitive policies. So we conducted the study in 4 countries: Tanzania and Ghana representing low middle income countries, South Africa and Malaysia representing upper middle income countries. So we used secondary data from FAO food balance sheet. We selected 13 food items. So we did the trends on time series, we did the trend and time series analysis for selected food item. Also, we analyzed the GDP to see how microeconomic dynamics may influence national food supply. So regarding grand total food supply, trends revealed differences among countries. South Africa and Malaysia, considered as upper middle income countries, had high mean total food supply, and Ghana attained high growth increase compared to other countries, while Tanzania showed a slower increase. So, and the total food supply across 4 countries was significant over 40 years period. Next slide, please. So the figure shows trends of per capita food supply of selected 13 food items for the past 40 years in 4 countries, as you can see. Thank you. Next slide. And regarding cereal supply, Ghana is the only country with significant increase in cereal supply, while Tanzania, South Africa, and Malaysia experience the decline. So despite the South Africa attained the high mean supply level, it has also experienced the decline for a long time. Thank you. Next slide. And regarding starch and root, Ghana had the highest supply of starch roots, consistent with its role as a staple energy source in West Africa. Tanzania ranked the second one, but had moderate decline, while South Africa and Malaysia maintained low level starch root supply, indicating minimal dependence within the national food system. Next slide. So regarding animal product supply, Malaysia and South Africa had higher per capita supply of animal products with upward trends over a study period, indicating both rising domestic production and economic growth. And Tanzania and Ghana maintain low supply driven by economic development and production capacity. Next slide, please. So regarding pulses supply, Tanzania had the highest supply of pulses, followed by Ghana, but South Africa and Malaysia maintained low pulses supply throughout the study period. So regarding GDP growth, Malaysia and Ghana exhibited higher and significant growth trends, while South Africa and Tanzania showed more modest and non-significant growth. So GDP growth in Malaysia and South Africa was associated with increase in higher value foods, including animal source food. So in conclusion, Ghana and Tanzania relied more on domestic food production, whereas South Africa and Malaysia showed greater dependence on food imports to meet the national food demand. So aligning microeconomic growth with agricultural productivity remains critical for strengthening long-term food security. So therefore, context-specific nutrition policies are needed. Thank you so much.
Then our next presenter will be Geoffrey. He will follow very soon. Thank you very much.
Yeah, thank you.
Geoffrey, over to you. Yes.
Thank you. I'm Geoffrey Asalu, also a postdoctoral fellow at CSIR and also a lecturer at the University of Health of Allied Sciences. My presentation will talk about the evidence from the FED project on how food environment leads to diet quality. Next slide. Why is this important? Yesterday's presentations of the food systems, the main actors of the food system, food production, food consumption, and food environment, they interact. And what we are expecting is to have improved nutrition, inclusivity, and reduce food insecurity, and also to have a sustainable food supply. However, the food environment is increasingly becoming unhealthy. That's how people are able to access unhealthy foods and also the affordability of unhealthy foods. So, next slide. So it has led us to poor diets, and the result of the poor diets is the fact that we have the coexistence of undernutrition and obesity, which is also a key driver of diet-related non-communicable diseases in urban settings. And this is more of a concern in very low resource or deprived communities. Next slide. So our study wanted to examine how food environment will shape diets and nutrition outcomes. So this is just part of some of our results. We use a cross-sectional study design that we examine also in spatial methods. We examine the physical food environment where food is accessed, and also what people eat and how they access this food. And like these studies were done in these 4 countries. Next slide. So the key evidence about the physical food environment is where these foods are purchased. Is we look at what we call the formal and informal food environment. The formal environment is the ones that are regulated, the ones that governments are aware of. But the informals are the ones that people can just in a day just set up a business or set up a food and sell, street vendors, etc. So, but the issue has been that in these 4 different locations, or in this, there have been differences. The formal retail environment dominated Malaysia and South Africa, where most of their food supply system are actually formal. While that of Tanzania was a mixed system of both informal and formal food supply system. Whilst Accra was highly informal. And when I see this informal, these are street foods, kiosks, tabletops, and even hawkers. Next slide, please. So the key evidence was that after doing our survey, we found that most of these of our participants purchase food with little or no farming or sourcing food from, almost purchasing food all the time. And most of them also rely on out-of-home eating. And most of them were concerned about what we call a food insecurity. We're concerned about their next meal, which is almost 6 out of 10 people were concerned about where their next meal comes from. And only about half of the participants can we say that have diverse diet. That means almost half of the participants had poor diet quality. And when we assess their nutritional outcomes, most of them were overweight and obese. Majority of them were overweight and obese. And the implication of this is that there is a coexistence of food insecurity and obesity, even in all these 4 locations. And one of the things that the physical food environment showed us is that more people are exposed to inexpensive, energy-dense, ultra-processed foods. And also the access to food through the informal food system played a very major role for how food is accessed. But on the other side, there is also an equal distribution of how food is accessed in these environments, which talks about the inequity in food supply systems, especially healthy foods. And these type of things are depicting the rapidly urbanizing communities, especially poor communities in low to middle income countries. Next slide. So the FED study provides some key evidence for change, and that for our discussions where people who live actually shape what they eat. Informal food markets are actually having a lot of ultra-processed foods, and which are unhealthy, high in sugar, fat, and salt. And interestingly, hunger and obesity are coexisting together, which is what we call the double burden of malnutrition, and can be found in these economies. And the overall discussion has to show that healthy diets really need a healthy system. Thank you.
Thank you, Jeffrey. And we now call on Wendy to do the next presentation. Introduce yourself and then go accordingly. Thank you.
Thank you. I'm looking at time and we've got literally 8 minutes left. So in the interest of time, I'll just try to highlight the key things in my presentation. But as introduced, my name is Wendy Geza and I'm from the University of KwaZulu-Natal. So my role in the project was mainly looking at the food policies and practices shaping the food environment in low and middle income countries in the past 40 years, with the idea that the data we collected from the policy analysis would complement what Nyabasi presented earlier on in relation to food supply trends. So this is basically the bigger discourse that our research was contributing to, which I think the previous presenters have highlighted extensively, particularly the importance of food environments in terms of shaping consumer diets and also consumer preferences as a whole. So I think we can just move on to the next slide. So with the policy analysis, we basically wanted to find out what are the key policies that relate to and shape the current food environment. We also wanted to understand these policies from a regional and national perspective and trying to understand what is the bigger aspect or what big effect do they have in terms of influencing the overall physical food environment. We also wanted to understand the processes and actors that were involved. Has it actually changed in the past 40-year period? And what direction is it actually taking? More so, we also just wanted to look at the critical gaps and challenges for us to be able to formulate our policy recommendations. Next slide, please. So in terms of the approach that we took, we did a systematic policy review in that we used the PRISMA-P guidelines for us to be able to collect data and also synthesize it. And in terms of where we looked, like I mentioned in the previous slide, we looked at the regional bodies that cover Africa and also the regional bodies that also operates in the Southeast Asia part of the world. And in terms of the national places where we had looked, we looked at key departments such as the Department of Agriculture, Health and the Environment. We looked at a 40-year time period, and we also then had experts that had a look of the list of policies that we had put together to identify if we had missed anything, and the expert covered all of our partner countries. And with the focus, we limited it to fiscal and regulatory policies because these have been proven to nudge consumer choices and also drive consumer demand for particular types of foods. So these are the 6 categories that we were interested in the policies that we had looked at. So in terms of what we found, majority of the policies that we found were non-fiscal policies, which basically means that these are policies that were regulation strict or regulation focused, that focus on food safety standards, strategic frameworks, and other supportive policies, which is category 6 on the previous slides, that were mainly looking at food and nutrition security, but also looking at the prevention and management of non-communicable diseases. So examples of these policies are in the last bar, such as the Malaysian Laboring Requirements, the South African Foodstuffs, Cosmetics and Disinfectants Acts, and so on. So those were the most dominant. Can you please go back to the previous slide? And in terms of the fiscal policies, these were approximately 10, and these ones are mainly limited to fiscal or monetary policies, such as the sugary sweetened beverages that's been cut off from the slides. And that was mainly prominent in South Africa and Malaysia, and also looking at other VAT systems, for example, in Ghana's Excise Duty Amendment Act and also Tanzania's VAT exemption tax. And another example, South Africa's zero-rated food tax that basically tax specific types of food groups, but these were mainly largely concentrated on staple foods such as your maize, milk, and other starchy products, and had limited coverage, particularly on fruits and vegetables. So that's why here I'm trying to highlight that very few of the policies actively subsidize healthy food for consumers. Most of them also didn't include any sort of support in terms of targeted food vouchers or discounts to encourage people to consume healthier food options. Next slide, please. I can see on the clock we've got 3 minutes left, so I think this will just be my last slide, and I will try to highlight the key learnings that were in the slides that follow. But in terms of looking at the 40-year period, we saw that there are three distinct policy waves that highlight how policy has changed over the past 40 years, with the first one being the post-World War II and early post-colonial era, where the focus of a lot of governments was ensuring that there is food available for populations and that food is safe to consume. So a lot of the policies were mainly targeted on that, and that also highlights the regulatory period. The second policy wave, which is the one that's in the green bars, highlights where the focus then now started shifting on, yes, people have food to eat and it is safe for them to eat, but is it actually nutritious? Is it diverse? And is it promoting healthy diets? So a lot of policies that focus on food and nutrition security started popping up around that time. And post 2015, that's around the time the Sustainable Development Goals came in. So we then started seeing the focus shifting to NDC agendas. So that's non-communicable diseases agendas, and also being more mindful and intentional in terms of fiscal and regulatory policies that discourage people from purchasing unhealthy, overly processed foods. So that's the time when a lot of these sugar sweetened beverages taxes came in, a lot of labeling requirements and so forth. I can see on the clock that we've got 1 minute. So I think a lot of the questions that people might have, I'll just stick around for the Q&A, and I'll hand it over to you, Dr. Alote, for the closing remarks. I think you can skip the last 2 slides. It's okay.
Thank you, Wendy. I think we'll plead with participants. Just put in to the chat your questions. We'll take them, and then even as we get.
I think we saved a bit of time from the beginning, so we can still have a 5-minute question and answer session that you can lead.
Oh, okay. Thank you very much. So anybody who has any question can raise up the hand, and then you can also put it in the chat, and then we shall read them as we go on. Yes. Any question? Clarity? Any clarity? Okay. I think I will proceed, and let's go to the next one. We are just expecting our Rose to give us a concluding remarks. Then if still we have 1 or 2 minutes, we can make use of it. Thank you very much. So Rose, over to you to give us the concluding remarks, please. Thank you.
Yeah, thank you very much. And thanks to all our presenters. The third project, indeed, is a project in which we built a lot of capacity because there's a growing interest in food environment research. So there's a need for us to ensure that we have, the young people who take up research in food environment. So in this project, we have 4 postdoctoral researchers. We have listened to 3 of them. And we also have 8 PhD students who are all trying to finalize their PhD work. So a lot has been done in this project. We have built capacity, and we are hoping that, the future looks bright, and we are going to implement the recommendations that will come out of this project. I can see there's a hand up, but let me just wrap up, and then we'll take the question. So we are wrapping up this project with a symposium, international symposium on climate change, food systems, and health, which will take place in South Africa from 24th to 25th August. We are extending invitation to everyone here, especially those who are living in South Africa. Because of you, we have extended the abstract deadline for abstract submission to next week. So you have up to 1 week to submit your abstract to participate in this interesting symposium where we are going to have all the postdocs, all the PhD students, and all our partners are going to be at this forum to share the key outcomes of this study. So on that note, moderator, there is a hand up. Dr. Wilhelmina Kwe.
Yes, thank you very much, Rose, for the wonderful concluding remarks. We are inviting all to this conference or seminar in South Africa. We have one hand up. Dr. Wilhelmina Kwe, please, you have the floor.
Thank you, moderator. And my name is Wilhelmina Kwe from CSR StEPPFoS, the director. I'm so proud of the team. I must say that this research has actually enhanced our capacity building programs. It has also given us a lot of evidence for policy making. Rose, I was just wondering, we should have extended this to our board members to also see what the wonderful work that the team is doing. And I'm just to say that indeed the future is bright, as the last speaker has mentioned, and this project, though ending, would continue in terms of the knowledge that we need to share. Thank you so much.
Thank you, Director. And thank you all the presenters for the wonderful work you have done. We are expecting collaborators, and we are expecting that people will link up with us and then join us in whatever we do, so that we'll have a fruitful and nourishing research. Over to you, Farah, please. Thank you.
Thank you very much. Thank you for the very rich deliberations from the presenters in session 4. So without then much further ado, we'll delve into the discussion later on. We can move on to session number 5. And then here we are transitioning to Innovation Spotlight. And we are going to specifically then hear about food safety systems and data platforms presented by Mrs. Olumodupe Bueno from S4 Africa and IITA and the CSIR Ghana. So maybe to just give a brief context to say food system is usually discussed as a technical issue, but then it's also a governance market, and also there are issues of public health, etc. So, Madam Bueno, the floor is yours. You can proceed, please.
Thank you very much. I see the time, and I see that you're giving us less than 30 minutes, but whatever. Thank you so much.
No, it's 30 minutes. Kanto, can you just reset to 30 minutes, please? Okay, thanks.
My name is Olumodupe. Can you all hear me?
I don't know if it's just from my end, but I think you've
Thank
been
you.
breaking.
Yes, thank you for correcting. It has been correct. Can you hold?
Colleagues in the room, can you just confirm if you're able to hear?
Is it better now?
I think it's breaking on my side too. Thank you.
We can hear her.
I think you are breaking.
Okay.
Maybe you can try to move to a spot with the better connectivity.
Okay, thank you. I see that you cannot hear me clearly.
We can hear you now. I think
Can you
you're
hear
good
me
to
now?
go.
I've turned off my
Yes.
video. So Great, thank you very much. So I had to turn off the video to help with the bandwidth. So it's good to be here, and I want to really appreciate the organizers for giving Food Safety for Africa project led by the International Institute of Tropical Agriculture in collaboration with CSIR Ghana, who is a beneficiary of the project also, to have this session looking at the Innovation Spotlight 2 and considering food safety systems and data platform. So without much ado, just want to encourage those who haven't included their names in the chat. Let us know where you're calling from and how you're participating in this session, especially for those who have come by the invitation of the FS for Africa project. As you can see on the screen, this is the outline of our program or the session today. We'll have the welcome, we have the introduction, roundtable session, technical exhibition, and then we'll move on to questions and answers. So I'm very mindful of our time. And it's my pleasure. Like I said earlier, my name is Olumodupe Banwo. I'm the project manager of the project. And it's my pleasure to welcome Dr. Titilayo Falade, who is a scientist with IITA and also the Food Safety for Africa project coordinator, to take us on the project introduction. Over to you, Dr. Titilayo Falade.
Thank you very much, Modupe. Please confirm if you can hear me well enough.
Yes, we can hear you. You may proceed.
Thank you. So moving to the next slide, I just really want to show us what the project is about. Yes, so we're a consortium of 16 organizations across 7 African countries. We have 16 partners, an associated partner in Canada, partners from Europe and in Africa, where we began our project in 2024, and we've had 2 general meetings so far. We've had quite a number of outputs, some of which we'll be sharing now. Next slide, please. So we're really addressing food safety in the informal sector. As we may know, food safety is a major issue within the continent, as Africa bears the highest burden of foodborne diseases. Out of the 600 million globally, 91 million cases are from Africa, resulting in 137,000 deaths within the continent, which is a large fraction of the 420,000 deaths that occur globally. We're trying to address this in a variety of ways, including accelerating our solutions, use cases that we've developed, having stakeholder meetings, advocating for change in policy and action at regional levels, coordinating AU-EU platforms, even organizing dramas. I would encourage you to look at our Food Safety for Africa YouTube channel and websites to see quite a number of things that we've already disseminated on our different channels. Next slide, please. Yeah, so I'm here showing just a dashboard of some of the major things that we have done. We have a food safety knowledge platform, which will be part of our exhibition. Fabiola Rezende will be presenting that. We have an Africa Food Safety Operators Network, which Dr. Dora Fiani will be presenting. And we have several in-country platforms, including the Food Safety for All platform that addresses traceability constraints. And we've had quite a number of inter-project collaborations, including coordinating World Food Safety Day Symposium. Later on today, you would also be hearing about the stakeholder engagements and mapping that we've had. We've been co-creating solutions with our partners at different fora, quite a number of resources, including research outputs that we have done. Next slide, please. Yeah, so I really just wanted to set the tone of what the project is about. It's a 6 million euro project, and I'll hand over now to Modupe to lead us through roundtable sessions and the exhibition that will really deep dive into some of the things that we have been doing in the project. And we invite you to collaborate, reach out to us for further engagement. Thank you. Over to you, Mutupe.
Thank you very much, Dr. Titilayo. Now I would invite our roundtable speakers. The first is Dr. Rose Omari, with the Chief Scientist, Research Scientist with the Council for Scientific and Industrial Research. The next is Dr. Sabine Deska, who is Research Coordinator, Impact Investment of Wageningen Social and Economic Research. And thirdly is Natasha Kaufeki, who is a Project Manager in the Refrain Forward. That's the dissemination partner of the project. So colleagues, I believe you're here on the call. So I'm going to start with you, Dr. Rose, and I would like you to tell us more about the stakeholder mapping and net map analysis, and give us a brief overview of what it is and tell us how it contributes to food system developments, especially the food safety. Thank you. Please be mindful that you have about 2 minutes each to respond. Thank you. Dr. Rose.
Thank you. I thought the slide will show so that they will see the network. So we have listened to the first session that is on food environment. They were talking about food in the environment being unhealthy. And they are not only unhealthy, they are also not safe. That is why this project really complements, all the other works going on to improve the food environment. And there are so many players in the informal sector in particular. If we have to deal with food safety, there are so many actors involved, right from the international standard setting body. We have codex. You come to the regional level, so many institutions are involved. We have ASO who are setting the standards. Then we have at the national level, we have so many actors that are involved. We have researchers that are also researching to contribute to food safety. We have donors who are giving funding. We have advocacy players. We have so many trade associations. So we are trying to improve, the safety of our food. So it's important, if we need to make any impact, then we need to really know who are the actors, who are the key players working to improve food safety in the informal sector. And so we carried out a net mapping analysis, involving the stakeholders themselves, because they are the ones who know people they have been working with. We have regulators, we have the ministries, we have the actors themselves. So we had a meeting, the stakeholder forum, where we carried out that exercise. That showed us, maybe if I can then share my screen, I really want you to see just the net map. Yeah. Are you seeing my screen or not yet?
Not yet, Rose.
Yeah. Okay.
Rose, please go ahead.
Yeah.
You will share. Okay.
Yes. Yeah. I really want them to see the net map. Yeah. So you can see how complicated our network of actors performing various roles in the informal sector. Some are providing regulatory advice, some are communicating and disseminating food safety information, some are providing infrastructure, some are having oversight responsibility on other agencies, funding, education, technical advice. So how do all these people have together to ensure that indeed we are really improving the food safety? So you can see over 120 actors, over 700 linkages, as you can see. So just to highlight briefly on the informal sector, they are always in need. They need funding, they need infrastructure, they don't have clean access to water and all that. But we realize that they do not receive funding directly. No donor gives funding directly to the informal actors. It is either through some other agencies, other research and academia, the ministries, advocacy players, trade associations, NGOs, and all that. So the question is whether indeed this funding that does not go to the informal actors directly, really get to them to really address the need for which those funding have been given. Then we also realize that they themselves are able to assist themselves. For example, you have aggregators that give funding to farmers. You have market queens giving funding to farmers so that they can be able to buy inputs to produce, food and all that. So even when it comes to infrastructure, that one, they receive it directly from those who give infrastructure, mainly the development partners, our ministries and all that. Then we also have another form of innovation where, for example, Food Research Institute in Ghana, they have a lot of facilities. So if you are an informal sector, you are into processing, and say you don't have a dryer, you can go to their facility and dry your product. And then we realize that there are some people that we don't regard as food safety actors who are also involved. For example, UNICEF is one of them. Africa Center for Disease Control is one of them. People will say that it is not their mandate, but it affects the work they do. My time is up, eh?
No, you're very passionate about this. But
yeah, so let me just wrap up. So, for example, UNICEF works with children. Previously, they would tell you they don't work on food safety, but they have realized that the food on the market, the cereal products are not safe. So they recently commissioned a study to really look at the level of heavy metals in cereals that are fed to babies. And the results are very, very, you marvel at the results. So it means that we cannot continue to say that it is only those who are mandated who have to do the work. We will work with other people whose work are also affected by food safety. So it means that we need innovative collaborative arrangement to bring on board the traditional actors and the non-traditional actors whose work are also affected some way or another. So I think this is what the key insights from the net map analysis. It is a whole, I can give a 1 hour lecture,
yes,
1 hour on this. So I'll wrap up. Thank you very much for your attention.
Indeed, innovative collaboration arrangements are needed. Now, may I invite Natasha to talk to us about the open call. Natasha, tell us, how can this open call expand access to food safety solutions in Africa? And what benefit does it bring to the AU-EU partnership? You have 3 minutes. Please start now.
Thank you. Good morning, everyone, and thank you, the organizers, for the opportunity to present our Food Safety for Africa project. I will speak about the opportunity to financial support third parties within the Food Safety for Africa project. We at the Food Safety for Africa project, we have designed the open calls as a mechanism to expand the project's impact beyond the consortium itself and support the development of practical, scalable and community-driven food safety solutions across Africa. In total, the project is launching 2 open calls, aiming to support at least 15 projects through the open call fund mechanism. The overall objective is to accelerate the innovation uptake in real life food systems, strengthen the collaboration between stakeholders, and support local actors addressing critical food safety challenges. Now, the first open call focused on identifying innovative food safety solutions from across Africa. It was launched in June 2025 and is currently under implementation. Through these calls, selected sub-projects are already developing and testing solutions related to food safety, traceability, resilience, and transparency within food systems. The second open call was launched very recently on the 18th of May 2026 and focuses specifically targets innovation hubs. These innovation hubs will provide training, mentoring, and capacity building support, both to the Food Safety for Africa use cases and to the projects selected under the first open call. So in this way, the two open calls are complementary to each other. The first one supports innovation development, while the other strengthens knowledge transfer skills and ecosystem capacity. Now, what's needed for the stakeholders to participate? Beyond funding, the open calls create important opportunities for ecosystem building. Yeah?
You have 30 seconds.
Only, okay. So participants can connect with each other, network, and support solutions that improve food safety practices. And next slide, please. So for anyone interested in learning more, all information is available through the official Food Safety for Africa website and the Open Call Funds platform, where applicants can access the guidelines, templates, FAQs, and application details. We also encourage all interested parties to engage with us through events, workshops,
Thank you, Natasha.
and network activities. Thank you very much.
Thank you very much. Thank you, Natasha. Thank you. So I would invite Sabine to talk to us about the use cases, but specifically tell us what is their relevance to sustainable food systems. Sabine, you have 3 minutes to take us through this. Thank you.
Yes, thank you for inviting me here. My name is Sabine Deschka. I'm from Wageningen Social and Economic Research. And I'm working on the working package for the use cases. So this is the space where we are analyzing, designing, and documenting systems that focus on the user experience. So specifically, we're looking into how specific groups interact and what that can lead to improved food safety. You know that we're using a mezzanine approach, meaning that we're accepting the informal sector, or not accepting, acknowledging that the informal sector is an important part of the food system, and that we want to work together with the informal sector rather than approaching them from a hierarchical perspective or regulations and other things. So this is really the space where we were trying to look into the use cases and how they do. So we have 4 use cases. One is on sustainable aflatoxin management in maize and groundnuts. One is on safer food with less toxic pesticide residues in legumes and vegetables. One is on safe and healthy vegetables and fish production through an online platform and mobile communication. So this one will be introduced later as well. And then there is the microbiological quality of tomatoes and leafy greens from farm to fork, which we're integrating as well. So a use case first needs a strong leader, somebody with a vision and who interacts with the system in its way that it works and that it works best for the informal sector. They all have a specific theme, a specific problem that we want to address, and I should improve the situation for agents in the informal sectors in any way. And then finally, there are different scenarios and descriptions. So it can range from software application to governance frameworks, anything that defines a system that could leverage food safety in the informal sector. We're not having any slides anymore. That's fine. We just keep it on here then. So what we so far learned from the use cases, how many minutes do I still have? Is that use case 1 and 2 in particular produce a lot of knowledge products that could be distributed and that are used for other things. They're trying to address the problem on different levels, from focus group discussions, stakeholder mapping, training workshops, and platforms for discussion and interaction. And use case 3 and 4 take a more digital approach, which will be explained later.
Thank you very much. Yes, you can put the link to where the use cases can be seen on the chat, or rather in the chat. Thank you very much. So we'd like to give room now to the technical exhibitors. And please allow me to invite Dr. Benjamin Emmanuel to talk to us about showcasing food. They're going to showcase Food Safety for Africa data platform for traceability, network, and knowledge. Dr. Benjamin Emmanuel, over to you, please.
Thank you. Mine will be a bit difficult without the slides.
Are you sharing the
Yes.
slide?
No, you said you would share the slide.
No, not you. Ire is sharing the slide.
Oh, okay. All right. Okay, so the basic idea, and it would come up in the slide, is that when we think of an informal market setting, the presenters that talked before us gave a bit of understanding of what that would look like. So a lot of non-regulatory attributes are present in there, and the ability to trace the product origin is also non-available. And one thing that is also peculiar to this market is the safety in terms of also packaging. So you would see that packaging is often a big issue when it comes to the informal market. So for instance, taking specifically the fish informal market, along the fish value chain from production to processing to retail, it's quite linear and quite simple in the informal sector. But then whatever happens, it becomes quite impossible to trace food safety as well as origin issue, as I earlier mentioned. And this is where we explore the synergies and likely win-win situation between proper packaging and QR barcodes. And this led to the off and online app on food safety based on packaging. So there's the packaging that is done, and from this packaging, the QR code should be able to deliver diverse information that is needed. In the slides, one of the things we came up with as part of the FS4A project is this QR code on packaging. And even if those that are here can click on this QR code, it would take them first to the origin of, for instance, in this case, fish, of the product, in this case, fish, and give them an idea where this fish is coming from. Is it conventional production? If you scan this QR code, is it from a novel aqua innovation such as aquaponics or RAS? And then it tells you, since it's processed, some food safety matrices. For instance, is there heavy metal present in this product? And given that we are talking of processed fish, it's smoked. So we need to look if this PAH, those are more or less the charcoals or the coal part you find from smoking these fishes, which could cause adverse health issues. What is the acceptable level that is present in this processed fish? On clicking that, we have just simple product health indicators for all of these heavy metals and pH. And that will be all for now. I think, thank you, Odube.
Thank you very much. Okay, so let me quickly invite Ms. Fabiola Rezende to talk to us about the Knowledge Hub. Over to you, Fabiola. You have 2 minutes.
Thank you so much. Hopefully you can see my screen, my slides. So it's a pleasure to be here. So I'm Fabiola Rezende. I'm Ubuntu. So we are the partner that take care of the digital knowledge platform. And we want to introduce you to this digital environment that it's easily accessible. So the idea of the Food Safety for Africa Knowledge Digital Hub, it's to make food safety knowledge easier to find, understand, and use. So across the project, a large amount of knowledge has been generated. So scientific and regulatory sources, protocols, training materials, practical sources that are connected to food safety across African value chains. And the purpose of the hub is to avoid that this knowledge remains fragmented across documents, partners, repositories. So instead, this platform brings the relevant content into one structured and searchable environment. So the hub is designed around a simple idea. So project knowledge should not be stored, it should support action. So users should be able to come into the platform with a practical question and quickly discover resources, insights, tools, that are more relevant to their context. So to make this possible, all the knowledge that enters the Food Safety for Africa database is curated and is classified based on the taxonomy developed for the project. So content can be organized by geography, commodity, food safety issue, value chain stage, and so on. And the video that you see in this slide, we start on the landing page, which is the entry point for any user. And as we move through the platform, you can see that the hub brings together different types of knowledge. So technical commercial solutions, different knowledge articles, industry and sectors news. And a key feature of the hub is the AI-powered search engine. So instead of only searching through keywords or browsing manually, the users can ask questions to the curated database developed by the project. So in this demo, we ask what low-cost technologies or practices can help informal market actors detect, prevent, or manage aflatoxin risk. And the platform then research through the curated database of the project and bring together relevant evidence and examples, including proved drying and storage practices, training and awareness programs, biological control solutions, and also emerging risk prediction models. So the AI-powered search engine actually supports more than 50 languages. And that's very useful because then the users, they can ask questions in their more favorable language and receive the answer in that specific language. Another important role of the hub is... Sorry, okay.
Fabiola.
Perfect. Thank you so much, everyone. Yeah,
thank you.
I'll put the link in the chat.
Now I will invite Dr. Dora to talk to us about the Food Safety Network platform. Dr. Dora, over to you. You have about 2 minutes to do this quickly. Is she online?
Ben, your mic is open. Maybe while we wait for Dora, I can talk us quickly through the African network launch that we have. Ire, can you put the slides on the screen, please? So within the Motopa, is that okay? Can I go ahead and fill in for Dora?
Thank you very much.
Okay, so the Food Safety for Africa project, I'll invite you to go to the website. If Ire or Natasha could put the link in the website, you would see that our project has a network that is bringing together stakeholders from public sector, private sector, development partners to interact and to get information that can provide collaborative opportunities and opportunities for the continent to begin to explore harmonization of policies, of structures, of systems that can lead to allowing the continent to achieve the agenda of the African Free Trade Continental Area Agreement. This would really help us to begin to see what we can do together. I'll give an example. Someone from Ghana wants to import, say, sesame from Nigeria, and he or she needs to know what are the requirements to allow this to happen. By going to that network, you're able to see the agencies to contact, the regulations that apply.
Hello, excuse me.
Yes,
the line was cut, and I would like to continue the presentation of the operators network database, please.
All right, okay.
Yes, please go ahead, Dora. I was just filling in for you.
I know. I don't know what happened.
That's okay.
The line got cut. at the bad moment. So, as you have seen, there are
please go ahead.
several.
That's fine.
Thank you. So, my name is Dora Fiani. I'm chairing Knowledge Economy Foundation, and that is the Egyptian partner in the Food Safety for Africa group. And we are implementing another angle, another component of digital information in this project. We have already seen two of them. This one has another purpose, which is to map the status of food safety in Africa in general, being understood that there are a lot of data on this, but the purpose of this network is to provide specifically to the business community at large in Africa with a scoping of the food safety status in Africa to enable better exchanges, better trade among the operators and stakeholders in the food safety value chains at large. So the project is composed of three parts. Within that slide, you see the reference to the Africa Continental Free Trade Area, and that is because to enable free trade exchange and benefiting from zero taxes, it's very important to have the basic common food standards to enable businesses to deal with each other. The network is divided in three parts. This overall Africa profile, and the whole network is, of course, digital and dynamic, and the purpose is to invite all contributors to fill in additional data in those sections, and contacts are in process with the Africa Food Safety Agency,
Dora,
related to the
sorry.
African Union.
Sorry to
Yes.
cut you. Sorry, I think you need to start wrapping up because we are already over time by 4 minutes.
Okay.
So we'll
Okay,
share
okay.
the presentation
Okay.
with all the
Yes.
participants. So you can just wrap up and then we proceed to close the session. Thank you.
I will. So, are you? So she's not bringing back the slides. Well, in any case, there are 5 pilot countries operating now in the project, and the key component is to have structured the 7 main activity types in the sector. And of course, we will be happy to receive any comments and questions and reply to them. Thank you.
In the chat. Now, what's the... Thank you very much, Dora.
Thank you.
For this session, we would like to close now on the chat and take the chat so that participants on the call can access it. So I'm sure we won't be able to take any questions now. So we want to wrap up this session. We'll thank everyone for being here, and we thank all our technical exhibitors and speakers and coordinators for their presentation. So with that, we want to say thank you to the FARA and organizers for giving us this opportunity. If it's okay with you, can we take a group photograph and then we will wrap with the same program for now? Is that possible? Organizers, can we quickly do that?
Colleagues, so it's 20 minutes past the hour. So we can proceed with our next session, which is on youth and nutrition system So we can proceed with our next session, which is on youth nutrition systems transformation, led by Gideon Yeme from NDDI Africa. So the session will sort of speak directly to the future of African food systems and the youth at the center. So Gideon Yeme, you have the floor, please. Gideon and the team for session 5 on the youth and nutrition system transformation.
Okay,
Okay,
yes,
can
please.
you hear?
Thank you.
Yes, we can hear you. Thank you.
All
right, please, you can proceed, Onyon.
Okay, good morning, everyone. Please, can you see my slide?
They're coming up now. Yeah, you can just put in presentation mode.
All right. Okay, good day, everyone. Thank you for joining this session. My name is Onyang Ubaba, and I'm the Director of Administration, NDDI Africa. Today, we'll be making a presentation on youth and nutrition transformation, and the members of my team include Mr. Iheme Gideon, the Executive Director of NDDI Africa, and Ms. Ujo Nora, the Program Manager for our Learning and Exchange Hub. A brief overview about NDDI Africa. We were established in 2020 and we are a youth-led organization, a youth-led research organization that is focused on providing evidence-based and data-driven nutrition solutions while building research skills of young Africans in Africa. Our vision is to have an Africa where quality evidence of all aspects of nutrition is available and will be used to tackle nutrition challenges. NDDI Africa has two main operational structures, our research work group and our professional development. To take over to speak on our professional development, I would like to invite the program coordinator for Learning and Exchange Hub to take over. Uju Nora, please, you can share your screen now. I'll stop sharing mine.
Uju is not online. I can't find her. If she's online, she should raise her hand so that I can make her speak up.
Okay, so during this session, we'll be providing an overview of. Has she joined?
I'm not sure she has joined. Perhaps you could just proceed, then we can hand over to her when she comes online.
Oh, okay. All right. So I just want to give a brief overview of what you would gain from us during this time. In NDDI Africa, we believe that the youths are both beneficiaries and also agents of change. So during this session, we'll be highlighting our commitment to African youth. We'll be highlighting our commitment to early career focused scholarship and capacity development in Africa. This is because we recognize that youths are both active and are both active agents of change, and they will also be beneficial to helping to shape our food system. So, okay, while we wait for Uju to start, while we wait for Uju to join, Mr. Gideon, maybe you can go ahead. Okay, Uju, are you here?
Hello, yes, but please, could I have a minute? Or Mr. Gideon can start. I had a bit of a glitch. I'm trying to set up, please.
Oh, okay, so while we wait for you to set up, one thing about NDDI Africa is that just like I mentioned that we are a youth-led organization and that we are part of a global coalition of youth-led organizations that are currently working to
strengthen the role of women and youth farmers in building a resilient, a just and a sustainable agri-food system. Now, this initiative that we are part of, as you can see on your screen, is aimed to support the coalition, support the consultation process of the World Food Forum, priorities. So we are trying to develop evidence-based advocacy outputs that are focused on digital innovation, youth engagement, and inclusive agri-food system. Now, as part of this coalition, we at NDD Africa, we are providing technical input on nutrition, diet quality, and concept refinement for advocacy brief. Now, last month we are part of one of the call to action where one of our members, one of our researcher and one of our program managers who took part in the empowering young women and youth to transform inclusive and resilient agri-food system. And tomorrow, our executive director, Mr. Iheme Gideon, will be part of a conversation on integrating technology, digital innovation, and AI for inclusive and youth-driven agri-food system transformation. So just to tell us that we are dedicated and that we are always interested in shaping the agri-food system, because we know that we are the agent of change. Uju, are you ready now?
Yes, please. Thank you so much, Barbara.
All right, I'll stop sharing my screen so that you can start.
All right, thank you. Okay. Good day, everyone. Apologies for my delay. Had a bit of a glitch before I could come in. It's a pleasure to be here, and thank you so much for the opportunity. Thank you, Barbara, for holding in. Thank you so much, Gideon. So, my name is Uju Honora, and I'm the program manager for Learning and Expert Exchange Hub. And this is just one of the professional development initiative by NDDI. And I was basically be talking about three core professional development initiatives, right? And then on one, we have the Emerging Nutrition Scientist Award, the Learning and Expert Exchange Hub, which is what I primarily lead, and then the Young African Nutrition Scholars Fellowship. I'll start with the Emerging Nutrition Scientist Award, and this is something that we have been going on for 2 years now in counting, started in 2024. The ENS aims to recognize and encourage outstanding research contribution among scientists in the field of young scientists, particularly in the field of nutrition in Nigeria. What we did is to partner with the Nutrition Society of Nigeria, NSN, which is the largest nutrition body and in fact the only governing nutrition body in Nigeria. So we partnered with them to give awards to 2 scientists. So it basically goes through some processes, right? So of course there should be an eligibility criteria which puts a quota on the kind of persons that we want to join in or to apply for this particular award. Of course, you have to be a graduate student, probably doing a master's, a PhD, less than 40 years. I mean, because again, we are very particular about this persons or this individuals being young scientists and residents in Nigeria. We have about applicants must be up to 6 months at least residents in Nigeria, and we have submission requirements, evaluation criteria. Over the last 2 years, we have been able to do this, and we have a current running partnership with them for 2024 to 2027, of course, and it's contingent on continuity. Is open to continuity, of course, contingent on funding offers and funding our funding power capacity. This was our past ENS awardees, Emerging Nutrition Scientists in 2024 and then in 2025. And sometime this year again, we're going to be having this, which because it's annually held during the Nutrition Society for Nigeria NSM conference. And then the other professional development initiative, which is what I basically handle, is the Learning and Expert Exchange Hub. And the core aim of the LEE, or the Learning and Expert Exchange Hub, is to equip early career nutrition professionals with practical research skills. Now, we basically envision, right, a scenario whereby researchers in Africa have all the technical competence, the technical know-how to conduct proper quality evidence-based research. Now, the way we have structured our webinars is basically a bi-monthly session conducted over 2 days, typically on Fridays and Saturdays, oftentimes due to participant feedback. And it's often a 2-hour session. So we try to get experts across the world, basically, because we've had experts from North America, South America, and Africa, of course, right? And just to come and go through this session with attendees who are primarily based in Africa to strengthen their technical competence in different various skills. It could be we have done a lot of training basically, and this is a couple of them, and it's obviously more than this. But and you're free to go to our YouTube page to find the replays. It's usually a live session because we offer an opportunity for a hands-on part, which is often our day 2. Day 1 is usually structured to have an intro section, and then day 2 are often hands-on. We don't just want people, or rather researchers, to have the knowledge or the theoretical knowledge, but the hands-on knowledge. So please feel free to go to our YouTube and go through these sessions for your learning. And then yes, the last but definitely not the least, right? We have the Young African Nutrition Scholars, right? The YANS Fellowship, which again is a little like the Learning and Expert Exchange Hub, but pretty still different and distinct and dynamic in its structure, because what we do at YANS Fellowship is basically also to equip early career professionals with hands-on experience, with skills to conduct cutting-edge research. But this time around, different from the LEE Hub, the Learning Expert Exchange Hub, what we practically do is to provide a structured mentorship with, of course, diverse facilitators through a certain period of time. So this is not like a webinar structure, like bi-monthly, the way the Learning Hub is, but structure. So sometimes the pilot cohort we had runs at about 6 months, which was first in 2023. And, we anticipate to run our next cohort in 2020, this year particularly, and there'll be a call. And it might be a very good time to say, please feel free to, sign up. It's open to Africa, youths in Africa. So please feel free to sign up eventually when you do see the call. It promises to be very, quite a very enlightening session, because it's hands-on mentorship, and something that we know that at the end of it all, fellows are able to also publish what they have done in reputable journals and even present in conferences. And yeah, these are program managers. I just wanted to take a moment to appreciate the work that they do. Precious Uche, who primarily handles the ANS award, and then Bila, and then myself over here. And then shortly, I'll share a quick video testimonial, right? And thank you. So I'm going to share a quick video testimonial from our pilot cohort of the YANS Fellowship. Just a snippet, just so you can see the kind of work that we do. I'll stop sharing my screen now and then share the video. Thank you so much.
African Institute.
Sorry, because of time.
Hello everyone, I am Uchechukwu Godspower Okoro. I am a research assistant at the West African Institute of Public Health.
My name is Kalibu Chamaka, a service member at University of Calabar Teaching Hospital.
Hi everyone, my name is Abachi Sufficient. I'm currently a member serving at the Dialysis Department of National Hospital, Abuja.
Hi, my name is
Hello, my name is Miracle Obi. I'm a Nigerian Youth Corps member currently serving in Lagos. I'm also a beneficiary of the YAMS Fellowship.
Good morning everyone. My name is Vera Ngozi Daniel, a serving corps member of the University of Calabar Teaching Hospital.
Hi, my name is Moye Okembi Gabriel. I'm a nutritionist, a researcher, and a content creator. I'm also a graphic designer.
Hello, my name is Ibeka Leah Nena. I am a nutritionist, copywriter, and a social media content creator.
I came into the NDDI platform as an undergraduate. The fellowship has fine-tuned my skills into becoming a better researcher and a data analyst. The experiences I gained at NDDI has not only helped me in deepening my empathy for vulnerable populations, it has also helped in reinforcing the importance of evidence-based interventions.
My experience at NDI, it helped boost my research and data analysis skill. It also improved my communication and problem-solving skill.
During my young age, I was exposed to so many research skills such as data analysis, quantitative writing, and reference management skills. The skills that I got from this fellowship were so realized and fun. And during this fellowship, I was also opportunity to present our research work at the conference.
And the journey so far has been exciting, has been thrilling and educative. It's been very wonderful, and I've gained a whole lot from the data analysis class and also the research writing, and I've earned money in the data analysis aspect. Wow.
Okay. I don't know to mean IP5 as well.
So because of time, and just so that we move right into the next agenda of our presentation, I'm going to stop sharing. And I'll just like to say again, what we do at NDDI Africa, it's basically exciting. And yeah, please feel free to join us or collaborate with us at some point. Thank you.
All right. Thank you so much, Uju, and of course, Sunyonu, for the insightful presentation. Please, could you stop? Okay. Yes. So, I would. We have had quite a lot about our professional development activities, and I would just highlight what we do with regards to evidence synthesis. And also, of course, this is also in collaboration with our professional development initiatives, because through the fellowships and, of course, other training sections, we actually develop early career researchers, not just to learn, but also to implement their work in collaboration with the NDDI, where we actually allocate different grants, to carry out this work, or we also get funding from other partners. So I would just highlight some of the key areas which is mostly connected with young people, which is the food environment work group and the pediatric nutrition work group. So all of these are some of our, the various ways by which we actually express our role. So you could see on the screen here, the pediatric nutrition work group has actually engaged in several works around child feeding practices and nutritional status. And of course, we have also been involved in a policy draft around undernutrition in Nigeria and the policy implications. We have also looked at the double burden of malnutrition, and then we are currently working on developing a digital tool that would support young people develop better lifestyles that would help curb, risk of obesity, and we are funded by the International Society for Behavioral Nutrition and Physical Activity Pioneers Program. So this is some of the very recently published papers that we have out of this pediatric nutrition work group, and some of these which I've highlighted are still, in peer review and will soon be published. So, another very central or pioneer. Hello, sorry.
Yeah, Mr. Johnson. Yes.
Hello. Okay, so another important part of our work is the food environment, because a lot of the conversations, it's about how we can restrict, some of this unhealthy advertisement to young people, because young people do not independently make these choices. Most of these choices were actually subconsciously enforced by all the media, projections and marketing. So that is also a core part of where our work is. And then we are a part of Informas. Informas is a big network conducting research and policy around the food environment. And for the last 5 years, we have been quite, active in doing this. So I'll just run through some of the works we have done. Apologies that I will not have time to share them in details. So in the aspect of food labeling, we have actually looked at the various labels of prepackaged foods. We have also looked at the composition of this prepackaged food, and we have looked at different aspects of marketing, both at the television level, so social media, and of course outdoor, advertisements that we see in both campuses and different other social, public places in Nigeria. And then we have also looked at prepackaged foods in supermarkets and how they actually positioned to actually entice consumers or lure them to purchase those products. So one thing about this, you can see that something like a quantitative ingredient declaration, which is key in determining the healthiness of a prepackaged food, is one of the least complied food labeling requirements in Nigeria. And of course, we can also see that claims has also become like a ploy to actually, advertise and market food products, always, making it look like they offer both health and nutrition benefits. And you can see they'll always use promotional characters and of course premium offers to that. So we've also conducted television advertisement. One key thing you would just note here is that while for one channel in a day, the rate of food advertisements in 1 hour in a day, every 1 hour in a day, is 1.43. Unhealthy foods, it's around 1.34, while healthier food options, it's 0.10. So that shows you what class of foods are being projected by the media. Of course, if you also look here, you can also see that the non-core unhealthy foods constitute 9 out of 10 of these categories. Also, when we sampled several social media accounts of both food industries and health promotion accounts. We can also see they're actually, adopting several, techniques to market their products. And yes, when you compare food brands, you can see they're actually much more focused on aspects of engagement, whereas the health promotion profiles offer more of nutrition content information. And then we actually also looked at which of the various approaches they use that tend to have more engagement, and we could actually find out that across the different social media accounts, it actually differs amongst themselves. So this is just to give you an overview of our work, and of course what we do, just to show that we're actually clearly committed to conducting researches on the areas that affect young people, because we as actually early career professionals are very, very interested in trying to shape nutrition, not just for the present age, but also for the next generation. Thank you so much. I would just hand over to Onyonu to finalize why we round up. Thank you.
Yes, thank you, Mr. Gideon, for that wonderful presentation. I believe we have given you value for your time. Please, are you seeing my screen? Please confirm that you can see my screen.
Yes, we can now. Yes, please.
Okay. So you've heard from our professional development lead and also from our executive director on our research so far. So please, if you have any question, kindly put it in the comment section so that we can answer them. Please, do we have any question? Okay, so while we are waiting for the questions, we are youth-led organization, so we are always open to collaborations. Please kindly follow us on all our social media channel, and you can also send us an email for any inquiry that you have, and we'll be glad to respond. Please, do we have it? Okay. All right. So we'll share. So, Mr. Gideon, they are asking for. Okay, so one of the questions on the chat is, Mr. Gideon, are we a part of? They're asking if we're a part of the Informas. If Ghana is a part of the Informas group.
Okay. Yes, please. Yes, I think in Africa, Ghana is actually, a very big, voice in that Informas network. Is actually being led by Professor Amos La of the University of Ghana, and there's actually a very big project ongoing now, also being led by the University of Ghana, which we are also a part of by the Agriculture, Nutrition and Health. It was launched last month. So yes, Ghana is actually, a part of it. But of course, you can always look up for Informas. One good thing about Informas has like series of protocols and tools that you can use to monitor food environment, and of course any researcher can actually make use of it. So all you just need to do is to actually contact Informas admin team, and then there would always be someone who would guide you on how to use that to get evidence that would shape this society. Thank you.
Okay, so another question. It says, okay, we were asked to share a paper. Please, can you indicate the particular paper you're talking about? It said, Mr. Gideon, may you share the paper with us? So if it's for the two research papers that he presented, yes, we can share it, and they are open source papers. Also,
right. Okay, I will just share that in the comment section.
Okay, so if you have the link, you can share to the comment section. Okay, so another question is by Mr. Daniel. He said, I'm currently working on organic farming agribusiness, and I would like to have access to your resources so that I can apply it in my marketing system. So, okay, please, I would also want to confirm, are you talking about the Informas protocol or our research? Which of our research?
Yeah, and also, like, because of time too, you can always write us in the info email, and we can have more time to actually engage with you. Thank you.
All right, so thank you all for joining our session. You can see our social media on our social media platforms. Please send us a DM or send us an email for any inquiries, and we'll be glad to respond. Thank you all for being here, and please do have a wonderful day. Thank you.
Thank you very much for keeping up to time, session 5. I think we've saved a lot of time, and you've been very concise and straight to the point. I think the The discussion has been very rich, and we've learned some insights from the youth perspectives. And now we'll proceed to the last session of the day, which is session 6. And it's based on evidence-based food safety and policy action. And it's led by Dr. Nkele Malahela from Northwest University, with contributing partners from FS for Africa and the FETE project. So this session then brings the day's discussion to sort of closer to policy action, where we bring out aspects of evidence, and that sort of informs decision to policymakers. So, Dr. Malahela, I think the floor is yours. Hopefully, I haven't butchered your name. Thank you. Dr. Malahela?
Sorry, I was just trying to mute.
Okay.
Good. Yes, thank you so much for
Thank you.
the handover. I want to just share something on the screen. Just a confirmation. I just want a confirmation that everything is visible. Is my screen visible?
We can see. No, go ahead.
All
Yes,
right.
we can see.
Okay, thank you so much. Firstly, let me greet each and everyone, colleagues, and our distinguished participants. As already introduced, my name is Dr. Nkele Malahela from the Northwest University. I will be facilitating the session on behalf of the Northwest University, and I would like to warmly welcome you to today's online panel discussion. We are delighted to have this platform and to have you join us for this impactful dialogue that we're going to have, focusing on strengthening the food safety and systems in Africa through evidence-based approaches. We have had via a lot of communications, challenges and concerns surrounding food safety, which is just not a technical issue, but a matter of public health, economic resilience, as well as consumer trust, because consumers tend to lose trust when such issues are flagged out. Then this conversation then makes it, comes at a really, well, at a really good time as food and food security and challenges continue to affect the world, both local markets and international trade opportunities. We would have seen what was currently happening in the foot and mouth disease that we're experiencing that kind of hindered a lot of international trade in Africa and beyond. So food security remains a critical challenge across Africa, with some recurring outbreaks of foodborne illnesses, inconsistent compliances, standards, as well as limited consumer trust in the agricultural value chain. But despite the availability of research that is there from all the institutions of research, universities, there is often disconnect between the knowledge generation as well as the policy implementation, where we find that several governments in Africa are struggling to institutionalize data-driven decision-making and also utilize that in formulating some of their policies. So this fragmented coordination among stakeholders weakens the effectiveness of this intervention. Hence, our theme today will be focusing on evidence-based food safety and policy actions. So allow me, colleagues, to introduce to you the panel members that have been brought to the discussion of this matter, drawing from the government, academia, as well as development organization. The aim is to explore how research and policy can be better integrated to protect our communities and also strengthen agricultural value chains. First in our panel, we have Mr. Jeffrey Ngaka, who is from the National Department of Agriculture in South Africa. And Mr. Jeffrey Ngaka is the Director for National Extension Reform in the branch Food Security and Agrarian Reform. He has authored policies and also coordinated several national policies. He will be focusing on policy formulation and enforcement. And second, I have Mr. Evans Chinembiri, who is a doctoral candidate in the agriculture economics in the Northwest University with 15 years experience in development across Southern Africa, and his work sits at the intersection of evidence and policy to build stronger and more resilient food systems. He'll be focusing on coordination of policy research policy and research, as well as the data generation. Then third, we have Prof. Granny Signolo, she is an agriculture economist, a researcher, and a lecturer at the TUT, which is the Tshwane University of Technology in South Africa, with a passion on food security, agribusiness, and sustainable development. And her work focuses on empowering farmers, supporting rural entrepreneurship, advancing innovative agricultural solutions. She is committed to using research and education to create meaningful impact in communities. And lastly, we have Dr. Tracy Mutungwa, who is a program coordinator at a Food Systems for Africa partner organization called that's the Food Safety Transformation Solution. That's a partner organization working at the intersection of policy systems, policy stakeholder engagement, and research policy integration. Her work focuses on strengthening food systems in Africa, particularly within the informal systems. So, ladies and gentlemen, colleagues, this is our panel, and without any waste of time, I will get into the actual discussion, where I will be posing leading questions to our panelists for them to provide us with their response in relations to unpacking the theme of the day. So the first question that will be to the government, the national, Mr. Jeffrey Ngaka. The question reads, how can government strengthen evidence-based policymaking to ensure food safety across agricultural value chains? Mr. Ngaka, over to you.
Thank you very much. Can you hear me?
Yes, I can hear you.
Okay, can you also see my slides?
Yes, Mr. Ngaka, if you could just put them in a slideshow. Thank you.
Thank you very much. And thank you very much for the invitation, Northwest University through Dr. Malashela. I was requested to present on strengthening evidence-based policymaking to ensure food system across the entire agricultural value chain. So with time limitation, I just prepared some few slides, and in the content, I'll just cover the legislative mandate. I'll also focus a bit on some of the cases of food safety concerns in South Africa, and focus on the tenets of evidence-based policymaking, and lastly on the implication for extension and advisory services, as she indicated, in extension and advisory services. We have a plethora of legislative framework that governs food safety matters in South Africa, and this is and it's not an exhaustive list, but this is some of the key ones. The Agricultural Products Standard Act, which regulates the quality and safety of agricultural products. And you have the Foodstuff, Cosmetic and Disinfectant Act, which oversees the manufacture, importation, and exportation of foodstuffs. the Animal Diseases Act, which manages livestock health to prevent the transmission of zoonotic diseases. You were mentioning the foot and mouth disease as one of the examples. Then you also have the Meat Safety Act, which provides for measures to promote meat safety and the safety of animal products. But these legislations are complemented by a variety of quality standards like your HACCP, which are not laws by themselves, but are essential for compliance and also for export market. Now, when you look at the South African case in terms of food safety concerns, in the few years, we had cases of food poisoning, particularly relating to informal markets due to organophosphate chemical. You know, the organophosphate is a pesticide registered in agriculture, but there are also cases that it is being used for rat control, particularly in townships. We also had a case of listeriosis outbreak in South Africa. We also had a case of aflatoxin contamination, particularly in maize and peanuts. Some of you in South Africa will recall the massive peanut butter recall in 2024. And lastly, the case I also want to highlight is the warehouses in KwaZulu-Natal, where police found they were actually used to store and repackage expired food. So those are some of the concerns in South Africa which made headlines. And in terms of the food poisoning in informal markets, particularly spaza shops, because this was linked to snacks in spaza shops, you recall the president announcing that all spaza shops now had to be registered. Now, going straight to the topic in terms of strengthening evidence-based policy making, I think what is critical is rigorous data gathering. We need to ensure that we have systematic approaches in terms of policy and making, using statistical data, using scientific research, using demographic data to define the nature and scale of our societal problem. And as a department at the moment, we are working on the National Food and Nutrition Security Plan. And if you look at the kind of evidence that is required there, that will assist us in finalizing the plan, is astonishing. Looking from implementation evaluation of the previous plans, from food and nutrition security surveys, from various impact evaluation studies that have been conducted. But also in government, we also have the Department of Planning, Monitoring and Evaluation, which becomes very handy in terms of evaluations. And most of these evaluations are actually very critical in terms of assessing both the intended and unintended consequences of the policy actions before you actually even finalize it. And we have a system called the Socioeconomic Impact Assessment System that we're actually using before you actually finalize your policy. All those policy discussion documents and draft policy needs to undergo this system, and you do it initially as you are going to consult and also after when you're done consultation. But what is very important is the continuous monitoring of policy action, because this is very, very necessary that you track the rollout of the policy to ensure that you make necessary adjustment during the implementation, and you can also evaluate thereafter. But what are the implications for these in terms of extension and advisory services? I think yes, extension play a major role in food safety, food security, and broadly in agricultural development. But in terms of this, it can strengthen on-farm hygiene and traceability practices, because that is very, very important producer and consumer awareness, also another leg that is also important linked to how we use our chemicals. So advice on safer water and chemical use, therefore, also becomes very important. Program director and facilitator, let me pause there to allow others to have an opportunity to present. Thank you very much.
Thank you so much, Mr. Ngaka, from the government side. Let us hear from the Northwest University. The question to Mr. Evans Chinembere. What role do universities play in generating evidence that informs food safety policies and practices? Over to you.
Thank you so much, Doc. And let me start by thanking the organizers for the platform, for putting a topic this important on the agenda. I think I want to start by saying food safety sits right where health, trade, and the people's livelihoods meet, and it really gets this serious attention. On the question itself, where does credible evidence come from? A great deal of it starts in the universities, the applied research, the laboratory testing, the surveillance of data that tell us what is in the actual food and what's going on in the supply chain. And just importantly, our universities generate a postgraduate pipeline that produces the analysts, the scientists, who can read, analyze, and act on the data that they find. So two things make university evidence extremely valuable here. I think the first one is that it's independent, and the second is that it's peer-reviewed. Say, for example, for when a regulator or a trade negotiator cites a finding, the credibility of that finding matters as much as the finding itself. And the credibility comes from methods that are transparent and are open to challenge. In addition to all of this, universities tend to hold the long memory in specific spaces. By this, I mean the data repositories, the longitudinal studies, the policy briefs that turn technical results into something a busy official can actually use and deploy. But let me be honest about where the limit is in the scheme of the broader conversation, because I think it really matters. Generating evidence is absolutely necessary, and that's the part that universities tend to do so very well. But oftentimes, I find that it's not sufficient. The evidence is only worth generating if it's built to be used. And in my experience, that's the gap that's missing between producing the evidence and actually using it. And that's where African food systems often struggle. Back to you, Doc.
Thank you so much, Mr. Chinembere, highlighting the gap that exists in between generating information and utilizing it, which also talks to what Mr. Ngaka has indicated in relations to how do you then, as government, utilize evidence-based. So I see a gap where you and Mr. Ngaka would come in and talk about how do we integrate, which is a question that I want to pose back to you, Evans. How can organization then coordinate the integration of research and policy in order to strengthen the food safety systems in Africa?
Thank you for raising that. And I think my doctoral research examines why smallholder farmers in Zambia adopt climate smart practices and why they do not as a whole. And the lesson that I've taken from this process is that the binding constraint is almost never the shortage of evidence. The science on what works well is usually very well established. I think where the breakdown happens is everything that sits between the actual finding itself and the implementation and deployment in the field. So the questions are, whose question did the research answer? Who translated into something that a policymaker could actually use? And was anyone actually funded, supported to act on it? So I find food safety in Africa is exactly the same problem. So my honest answer to the integration question is that it's not an event, it's not a workshop, it's not a launch. It's a system that needs to be built, funded, and measured. And I want to put three things on the table as it pertains to this. First, integration has to start before the research does, not after it. When regulators, researchers, the businesses that actually move the food frame the question together, the evidence comes out ready to use. When research is designed in isolation and then disseminated, it lands on a shelf. And the shift really is we need to stop publishing at policymakers to producing research with them. The second point I want to make is that somebody needs to do the translation, and this is a permanent job and not a favor. The technical risk assessment does not turn itself into a regulation. That means we need standing platforms where this exchange is routine. Something like a National Food Safety Observatory, science policy panels, and a forum such as this one, where we can make sure that this link continues to happen routinely and consistently. The mistake we keep making, I think, and I feel in my experience, is that we're treating coordination as a one-off rather than as a standing institution as its whole. The third point I want to make, and this is the one I want to push the hardest, is that we need to frame food safety as a market access issue, because that's what unlocks the money, the political will to take action on some of the findings. Let's take, for example, the African Continental Free Trade Area. Food safety is no longer a healthy question, it's a trade question. If a Zambian or Nigerian product cannot meet a credible evidence-based standard, it cannot cross the border. Harmonized sanitary and phytosanitary standards built on shared evidence backed by traceability are now the price of a continental market. If we frame it this way, the food safety attracts the investment that a pure public health argument will struggle to achieve. So bringing it all together, universities generate the evidence and they should keep doing it well. But if we want resilient food systems, we have to stop asking for more evidence and start building the institutions that use the evidence that we already have. We need to co-produce the question, fund the translation, and tie food safety to market access. And that is how research and policy stop being two separate conversations and become one. Back to you, Doc.
Thank you so much, Mr. Evans. I think you're highlighting quite a number of key things that we need to really take away as an African continent if we really want to produce a resilient food systems. You are highlighting the fact that there is a lot of disjuncture between how knowledge is generated and how knowledge is utilized, and that all of that emanates from the fact that we are working in silos as institutions that are producing something that is so interconnected that actually could connect all of us as institutions for us to see a transformed food systems, a transformed Africa. So this leads me to a question in relations to as different institutions. For example, we need to collaborate. Why are collaborations and partnerships so critical in terms of advancing the evidence-based food systems? And how can universities lead this space? This I want to address to Professor Signolo from the TUT. Over to you, Prof.
Chair, you have asked me two questions. Why are collaboration and partnerships critical? And how can university lead in this space? Chair, collaboration and partnerships are very critical because, as you have said, and the latter speakers, food systems are complex and they are interconnected and they involved multiple stakeholders across different value chain, such as production, processing, regulation, and consumption. So there's no single institution that can solve food safety challenges alone, not at all. So that's why one of the speakers, Rosa Mari, also pointed that the importance of identifying stakeholders involved in food safety issues. So universities, governments, industry, farmers, researchers, and communities all contribute valuable knowledge and technology to build a safer and more resilient food systems. In addition to that, Chair, partnership also strengthen the generation and the use of evidence, as you have mentioned, by ensuring that research moves beyond academic publication, as Evans had said. It's high time we don't just do research for publication, but we need it into practical application and policy. To answer your second question, Chair, on how can university lead in the space, Universities are actually uniquely positioned to lead because they act as a knowledge hub and neutral spaces where different stakeholders can come together and share information. They are able to bring government, industry, researchers, farmers. At TUT, we had a dialogue a month ago where all the stakeholders with talking the issues of agri-tech were involved, starting from Stats SA. So everybody should be involved. As Evans again said, before research is done, it's high time things are done before research, so that whenever research is done, knowledge is there, we are able to impact the system properly. So beyond research, Chair, the university also contribute through community engagement and extension programs by translating scientific findings into practical training. We can't just continue doing science and economics while we don't actually translate it in a layman's language so that the user of this particular information is able to use it and understand it. So in a nutshell, that's why that's how the universities can lead in this space, to open their doors and make sure that collaboration and partnerships works for the people. Thank you.
Thank you so much for highlighting that. I think those are quite important aspects that you are raising, not only to just highlight what institutions, what the university is responsible for, but also highlighting the fact that there are post activities that universities are engaged with that include translating this research into more actionable or more practical ways of implementing this project. So we really have to start thinking twice. We really have to start changing the status quo, changing the way we approach things, the way we do things, the way we are coordinating ourselves as different organizations as within the African space. And that is really truly answering and responding or unpacking why the importance of collaborations and partnerships. And which then brings me to thinking surrounding when we have this particular coordinated or integration where universities will work with development organizations, will work with government, farmers, and everyone that is involved. We will need to then have people. We cannot all play referee. We will need people who will then assume different roles. And one of the key role that was raised by Mr. Ngaka as well in terms of how government does its own evidence-based and monitoring and all of that was the issue surrounding the monitoring and evaluation, which seems to be important in informing some of the processes that are happening, informing the implementation of these policies. And this brings me to a question of how do we then get institutions in the African continent to lead in trying to strengthen the monitoring systems to ensure that food safety policies are evidence-based? Who then takes a leading role in as much and in terms of monitoring the policies, monitoring the integration itself and the coordination, and ensuring that we're having policies that relates to food safety that are evidence-based and effective? This I would like to pose to Dr. Tracy from the Food Systems for Africa. Over to you. Dr. Tracy?
So she doesn't have permission.
Okay, I think it's been granted now. Can you all hear me?
Yes, we can hear you. Over to you.
All right, thank you. So I'm sorry, could you please just repeat the question?
Okay, so the question emanates from the fact that integration has been highlighted as one of the most important thing in avoiding silo operations from each and every institutions. And one of the things that was also highlighted by Prof. Signol is the fact that we need to, we already understand that university is a leading in terms of it's a knowledge hub. So it's one of the institutions that could lead in terms of information generation, and government could lead in terms of legislation and all of that. Now, what we want to understand is then how do we then ensure that we monitor these processes? How do we see a leading institution within the African space that will help us strengthen the monitoring system to ensure that these food safety policies are evidence-based and are effective?
Okay, so thank you for the opportunity to contribute to this discussion. And to answer your question, I think that development organizations actually can play an important role in coordinating the integration of research and policy in strengthening food systems in Africa, mostly because one of the recurring challenges that we found in food safety systems is the disconnect between the research, the policy, and the implementation. So research findings are often generated, but then translating them into practical and context-sensitive interventions requires ongoing engagement between the researchers, the policymakers, the communities that are affected by the issues at hand, and any other stakeholders that may play a role. So within the Food Safety for Africa project, one of the things that we've really seen is the importance of stakeholder engagement and multi-sector collaboration, particularly when you're looking at the informal food systems and diverse local contexts across different regions in Africa. So development organizations can help to bridge those gaps by creating platforms for dialogue, supporting evidence exchange, facilitating partnerships, very important, and helping to align the research outputs with policy priorities and implementation realities that are actually happening on the ground. So it's also important, the coordination role is also important to avoid fragmentation and duplication of efforts. So, for example, you can have the Ministry of Agriculture is discussing farmers. Then you have the Ministry of Health discussing foodborne diseases. Researchers are publishing reports. NGOs are engaging in food safety training. Policymakers may or may not be using the research that has been conducted. And in all of this, the informal traders have not been included in any of those discussions. So the development organizations can help in this manner by creating those platforms where we can keep having these ongoing discussions, and that can help to also bring about more information regarding practical decision-making and action. Thank you.
Thank you so much, Dr. Tracy. Colleagues, in the interest of time, I'll just like to quickly wrap up. There we have it. Our team of experts has actually outlined quite key and critical concepts and aspects that we really need to take home if we want to see a different or a transformed African continent with less food security concerns. We really need to start implementing some of the key things that they have highlighted, approaches relating to the fact that we are faced with a sectoral problem, something that is not only involving the Ministry of Agriculture, the Ministry of Health or Public Health or anything, but something that involves multi-stakeholders. So we need to start working as a multi-sector taking a multi-sector approach, but more importantly, also building systems that are multi-sectoral that supports the multi-sectoral approach. But most importantly, the fragmentation part is also highlighted as one of the key things that are hindering the food systems, where we also seen how it's actually elevating the gap between the research and the implementation and the policy development. And we need to start working and taking advantages of platform, utilizing development organization, which is highlighted by Dr. Tracy, that they play a very critical role in terms of making the integration alive. And we need to also look at a role of each and every institution, the universities that was and their roles that was highlighted by Prof. Signolo, government and their role, and see how each in this multi-sectoral system can play a role in terms of making sure that we have a system that is built to support food safety from the multi-sectoral approach. So with that being said, I think there's a lot that we really need to work on, and this 30-minute session, I don't think it's doing much justice in terms of sitting and getting to the core of where the problem is and how we really have to strategize and move forward in terms of developing this multi-sectoral approach that is going to work for us, where we are taking note of all the roles that each and every organization is playing from different sectors, health, agriculture, transportation, because when you talk of food systems, you're talking of a value chain. So that requires more than just the Department of Agriculture or the Ministry of Agriculture. So with that said, colleagues, I would like to urge each and everyone that is here that we really need to start thinking differently for us to have a transformed Africa, a transformed food systems that we want to see, where we have minimal challenges when it comes to food safety, because that talks to a lot of things, health, mortality rates that are increasing, that all of that emanates from the food system, emanates from the food safety concerns. So we really need to strengthen Africa and also ensure that we have integration. We integrate research. Maybe we can even look at a policy that would bring the policy and practices and research together that can actually help us in building a food system that is resilient and that is able to protect consumers and also empower farmers and strengthen the market access. With that said, I would like to pause and hand over back to the facilitators for any questions. We will have to address them during the question and answer session. Thank you, and thank you to the panel for sharing your expertise on this matter. Thank you. Over to you.
Thank you very much. Very rich conversation indeed. And as we get closer to wrapping up, maybe we can just have one or two questions from the participants, and also maybe for the team to check if there are any questions in the chat that are directed to them. Maybe they can also respond to them at this time. Are there any questions in the chat? No? Okay. Colleagues, any questions?
Someone is asking if there will be access to the slides or the recordings.
Yes, definitely they will be shared. Everything will be shared with all the registered participants. Yeah. Any other questions, be it on logistics? Okay, Rose, I see your hand up. Please, you can go ahead and make your intervention.
Yeah, thank you very much. There is something that I have observed in the way we develop our food standards. So, for example, when standards are developed, definitely by a few experts who meet and then work on the standards, and then they are shared with the public for them to make their inputs. And this public will include the academia and people who have expertise in those areas. But then I have realized that the time period that you are given to make comment is always so short. I even had one yesterday, was the deadline. I couldn't make any inputs. So I don't know whether these things happen in your countries as well, whether it is codex, standard, or whatever. You know, they give you a period within which you have to make your comments and all that, and there is so much pressure and all that. So I don't know what suggestions we have in improving the way these things are done so that experts are given adequate time. I know sometimes we also don't make much commitment. You know, you receive it and then you don't make time aside to make inputs. So it is both ways. Sometimes we receive it, then we don't make input. We have all the knowledge, but we are not making our contribution to the creation of all these standards and all that. So I don't know if you have also experienced this and how we can improve on this process of making our expertise into critical things like standards. Yeah.
Thank you very much, Rose. Colleagues, I think that's open to everyone. Any reflection based on that intervention from Rose?
Yeah, maybe if I can just share our experiences. I think Rose is correct, because the time limitation is also linked usually with what you have planned in terms of the policy development timelines. But I think as stakeholders, both in academia and the private sector and the non-governmental organization, is to create close links and partnerships and collaborative platforms with government, because usually before we even go for gazetting policies for public comments, you will find that there are consultative platforms that are being used during the conceptualization as you are developing draft policy document. So such expertise needs to come in at that level so that they shape the policy during the initial development stage. By the time it goes for gazetting, you are just now opening up for everyone else whom you may not have consulted during the development phase. And that phase is usually limited. On our case, we usually limit it to 30 days. Unless you are gazetting around December, usually you do 60 days, because December, January is a very tricky period. So you usually do 60 days at that period. But I think if you can actually collaborate on a regular basis with the government departments as the key stakeholders in academia, you will actually have enough time and platform to make policy input. Thank you very much, Rose, for raising that one.
Thank you, Mr. Ngaka. And yeah, so any other intervention? Okay. I think we can bring it to a close. So I'll just give a bit of a summary from my notes of what has been discussed today. So the discussions overall reinforced the sustainable food systems transformation, that they must connect nutrition, food safety, youth leadership, and also the key aspect of policy action. So the evidence presented showed that the food environments are shaping dietary choices in powerful ways, with unhealthy, ultra-processed, and unsafe foods becoming more accessible, while affordability and inequality continue to sort of limit access to health diets. So we also heard that the food safety is not only a technical matter, but a governance, data, market, and public health issue that requires sort of stronger coordination across the regulators, the researchers, the informal market actors, and also the private sector players. Equally then with the policymakers on board. And then lastly, the youth session reminded us that young African professions are not just the future beneficiaries of the food transformation, but they are active. They are also very active researchers. They are innovators, and also policy contributors to the discussions, more especially what we've seen today. So overall, the key message here is clear, even from the last session that we are just from having now. African food systems need sort of a strong evidence base and better data platforms. Also, it needs inclusive capacity building and strengthening, and also deliberate policy translation, so that research moves beyond the discussion tables and informs practice action for safer, healthier, and also, more importantly, resilient food systems. So with that, colleagues, unless there is any logistical announcement from the team, more especially on the upcoming dialogue tomorrow, and also that FANAPAN in its capacity as a convener on food systems, we are convening a policy dialogue in Bulawayo next week, and it's a hybrid event. So there's registration open across our platforms. You can check our website at www.fanapan.org or our social media platforms, which is at Fanapan. We'll be grateful to have you on board and continue with some of the discussions that we've seen in this session. So, colleagues from the organizers, any logistical issue, any announcement before we bring the meeting to a close? Shiluba, any announcement before we close? Okay, colleagues.
Thank you, Siwilanju.
Okay. Yes, please go ahead, Shiluba.
Thank you. Colleagues, just to urge those who are presenting today to kindly share their presentations with us, since I believe most of the participants would like to also go through them. Because others as well, their presentations were rushed due to time. So I think it would be good that we also share that with all the participants. Apart from that, I think that's all from my side. Thanks.
Thank you very much. Colleagues, thank you very much for bracing the 2 hours plus with us. I think it has been a very rich discussion. And like I said, there are more platforms ahead next week and in the coming months, and we'll be glad to continue with some of these discussions. So you can also keep following the StEPPFoS Africa website and also their social media platforms for more information about this topic. I thank you and see you next time.